All right, let's get straight to it. If you're a healthcare professional looking at taking the OET, you've probably got two big questions on your mind.
Who can actually take this exam, and what's the structure like? Let's break it down, nice and simple.
So the first thing to know is that the OET is specifically for regulated healthcare professionals. In the exam itself, it's kind of split into two parts. You've got some sections that are the same for everybody, and then other sections that are custom built for your specific job. So first up, let's tackle that big question. Are you eligible?
Okay, so who exactly gets to take this test? Well, it's not for just anyone. It's designed for a very specific list of professions. The list we're about to go through is the one recognized by AFPRA. That's the Australian Health Practitioner Regulation Agency. Let's see who's on it.
All right, here we go. We have Chinese medicine, chiropractic, dentistry, and that covers both dentists and dental hygienists, medical radiation practice, medicine, which is for doctors and interns, occupational therapy, and optometry.
And the list continues with osteopathy, paramedicine, pharmacy, physiotherapy, podiatry, psychology, nursing, and finally, midwifery. So if you heard your profession in there, then OET is for you. Now that we know who can take it, let's dig into how the exam is actually built.
This is where the OET gets pretty smart, actually. It's not just some generic English exam. It's cleverly designed with two distinct parts.
Okay, so you have two parts. On one hand, you've got reading and listening. These sections are the same for every single profession. They're all about testing your grasp of general healthcare English. But then, on the other hand, you have the speaking and writing sections. And this is where it gets personal. These parts are tailored specifically to your profession, so you'll be doing tasks that actually feel like your real job. You know, things like patient role plays or writing a referral letter.
So you might be wondering, why split it up like that? Why not just make the whole thing specific? Well, there's a really important reason behind this design, and it all boils down to one thing: patient safety.
Think about it. This two-part structure does something brilliant. It makes sure that every single person taking the test has a solid baseline, a good foundation in general healthcare communication. But at the same time, it zeroes in on the communication skills that are absolutely critical for your specific role, the stuff that really matters when a patient's well-being is on the line. So in the end, the OET isn't just checking if you know English. It's checking if you can communicate effectively and safely as a healthcare professional. And really, that's what makes it so different and so important.